Okay, so let's talk about this title. The saying goes back to at least 1980 with respect to advertising, but also development of new businesses. I've heard it in a product development context when engineers are frustrated with what they see as impossibly high standards that don't account for technical complexity. The message is clear, but when it comes to health data and research, I think we can have it all. It'll just require a bit of infrastructure. So let's start by looking at the current workflow for health data research and innovation. To illustrate, I'd like to share a story you may relate. We could call this the scientist without data. And I think it applies to clinical research and data analytics as well as AI R&D, which is my background. But in fact, let's focus on health data and specifically hospital data. So this slide summarizes the journey for a researcher in Australia using hospital data. We start with an idea, we prepare a proposal and study design. We probably go through a few iterations of this. Eventually, funding is awarded, we wait for data. And only then can we start work on data pipelines and analysis. This isn't great. In Australia, what we're hearing is it often takes 2 years for access. So a substantial portion of a project period is spent idle. And perhaps even worse, there's very little opportunity to iterate on study design, data processing, or the data request. Now, we could ask, is the scientist's pain a necessary side effect of appropriate governance? So let's step back and think about it collectively across the research sector. For the research community, the feedback cycle is slow and expensive. Really, it requires multiple studies, and there's a really high barrier to entry. And this is inefficient. So we're running studies also with limited information, and studies that receive funding and data support might not even be feasible. For example, where available cohort does not statistically power the study, or where there are issues with the data extract. And if we step back further yet, it's also suboptimal for funding bodies, data custodians, and ultimately consumers. Still, we could ask, so what? What are we really missing out on? So let's just consider the MIMIC data set for a moment. MIMIC stands for Medical Information Mart for intensive care. I'm sure a lot of you are familiar with it and have used it in your research. It's a partnership between the MIT Lab for Computational Physiology and a single hospital in Boston. And what they've created is simply a de-identified ICU dataset that's free to use for research. Now here's a big number. This one single dataset has been used in more than 4,000 studies. This includes clinical research, predictive modeling, resource optimization, decision support, and AI research. There are a few other really, really interesting reference points. And just to mention a few, it's the All of Us Biobank is another one that's really, really interesting. And we spent a lot of time last night talking about Mayo Clinic Platform, which I think is also really paving the way for getting things for translation and putting things into practice. So both as a health consumer and as a researcher, I really want this for Australia. So what if? What if we had fake data that doesn't include any patient information? What if this fake data had the same format as the real data? What if this data also replicated the underlying statistics of the real data? And what if it was easily available through standard credentialing and data use agreements? What if we had synthetic health data? I think this is a really exciting opportunity, and I believe we can create the Australian MIMIC, but better because it's safer, it's more accessible, and it's multiple site. And that's why we're working on establishing best practice and clinical infrastructure for synthetic health data, and ultimately working with health services to realize the value of their data and digital operations. I believe this can benefit all stakeholders, but let's just consider the first two here for a second. So first, as a health service, I want health data to drive a learning health system using quality indicators to drive performance and innovation. I want to collaborate on valuable research that improves outcomes and experience. I want to be able to vet ideas and solutions before investing in retrospective extracts, implementations, or trials. As a consumer, I want health data to contribute to service improvements across the 6 domains of healthcare quality. I want a better understanding of health data, its contents, its use, and its quality measurement. And I think this captures another use case, which is using synthetic data for consumer engagement. And the last 2 personas on this slide bring us back to our sad scientist without data. So let's consider the new and improved workflow for health data research and innovation. Synthetic data improves the research workflow in 3 ways. We have better research because it's now possible to do proof of concept analysis and feasibility testing before applying for funding. We have faster research because it's now possible to be productive in the period between receiving funding and receiving access to real data. And we have cheaper research because data custodians and funding bodies can now use proof of concept results to vet research. And this means that they can be more strategic about where to invest their time and money. And all of this is why we're working together to build the community of practice. So SynD community initiatives currently include developing standards and guidelines for safe and effective synthetic health data, implementing a rigorous open source evaluation of privacy, fidelity, and utility, and fostering innovation for improved health outcomes through knowledge sharing. And we're keen to connect with anyone who's interested in exploring synthetic health data. So this is also a call to action. Please reach out, fill out an expression of interest, or chat with us if you are interested in joining the community. So as an early stage community, we've started with a core membership that's aligned on mission and shares a desire to contribute to our initiative. So this is a bit small, but this shows the people who are putting an effort into building this community at the moment. And we are keen to grow from here. It really does take a village. So a special acknowledgement to generous establishment support from the Digital Health Cooperative Research Center for their vision and for all of the support from Mel Haynes and Annette, and especially all of the founding members who meet regularly to share experience and drive common infrastructure. So you'll hear a bit more about this particular project from Amir just a bit later, but very quickly, we think that project-based learning is a great starting point, in part because we can draw on a cohort of over 500 students doing data science and digital health projects every year. So this is the project that Amir and I are currently working on at Sydney. We're working with services who are custodians of health data sets, and we run projects with groups of students. The students gain invaluable experience with realistic data. And the partners access not only insights and solutions from a crowd of contributors, but also a qualified recruitment pipeline of graduates who are already familiar with their data and their problems. So please do reach out to Amir or I if you're interested in project-based learning with synthetic health data. At the end of the day, we want to democratize health research and AI. Synthetic data opens the top of the funnel for health data research and innovation. It supports medicine and health scientists, improving quality and quantity of research. It supports clinicians, optimizing their practice against standard performance metrics. And it supports digital innovators, building safe and effective tools for diagnosis, treatment, patient engagement, and service efficiency. What I'd really like to see is this then growing into an end-to-end platform for health data research and innovation. Ultimately, we're making big investments in digital patient records. This is hard work. It's really important work. On top of this, in order to really scale research and translation, I believe we also need a health data platform. So when it comes to health data research and innovation, we believe that it is possible to have it all. And together, we can build the community and infrastructure to be good custodians of our health data.